Hello friends, welcome to Baby Help. I'm Dr. Sandip Gupta, Senior Pediatrician and Child Care Expert. So today I'm going to talk about a very essential vitamin for child growth and development, that is vitamin D. So there are a lot of understandings and misunderstanding about vitamin D, and today I'm going to clarify about the role of vitamin D in child health. So let us start by saying that vitamin D, we all know, is very important for our bone growth. How it helps in bone growth is it actually helps in absorbing the calcium which we take in our diet through the intestine as well as the kidneys. And not only that, actually vitamin D has a very significant role in making the bone strong. So in the bone architecture, calcium has to be deposited to make the bone strong. So there also vitamin D plays a critical role. So vitamin D helps in depositing the calcium in the bone. So both ways it is very important for calcium metabolism and phosphate metabolism. So it helps in calcium and phosphate absorption as well as deposition in the bone, thereby making the bone stronger. But it is not limited to only bone growth or skeletal growth. It is also a very important vitamin for our immunity. So for immune function also, it has been seen that those children who have a very good vitamin D level, they kind of develop lesser flu-like illness, lesser ear infections, and pneumonia infections are less severe in them compared to those who have lower vitamin D levels in their blood. So that's why American Academy of Pediatrics has recommended that all children who get pneumonia should be treated with vitamin D also sometimes. So this is very important. Apart from that, vitamin D has some role in preventing allergy and asthma also. So there are multiple benefits for vitamin D. But the problem is in India, almost 50 to 90% of children are actually deficient in vitamin D. And I am going to explain what is the reason. The reason behind vitamin D deficiency in children is vitamin D is not naturally available in common diets. So there are very few sources in the general diet which actually have good quality vitamin D. So that among that is fatty fish, liver, eggs for non-vegetarians, and vegetarians, there are limited sources like cheese, yogurt, or fortified milk. But apart from that, there are no major sources, and the other source for vitamin D is sunlight. But the problem with sunlight is it is the UVB rays which actually synthesize the vitamin D are available between time of 10 AM to 3 PM, which is the time when most of the people will be inside their homes, and the sunlight is not sometimes tolerated by many people. Many people don't like to go out in sunlight, and because of the current pandemic situation also, many people are actually restricted to their homes. So the vitamin D deficiency has become a common problem in our children. Now, how to overcome the vitamin D deficiency? The major way to overcome the vitamin D deficiency is to do nutritional supplementation. Vitamin D is a very cheap medicine and it is available very easily everywhere, and we recommend that every child who is doing breastfeeding or formula feeding or whatever feeding should take till 1 year of age every day 400 international units of vitamin D. So as a pediatrician, I prescribe vitamin D to all children who are less than 1 year and coming to my clinic. Vitamin D 400 international unit. Even after 1 year, you can actually continue vitamin D supplementation in small doses like 400 to 600 international units to meet the daily requirement of vitamin D, because like I said before, the dietary sources may not be sufficient and sunlight exposure is also very variable. First of all, the sunlight exposure is variable, and then all the sunlight is not helpful in vitamin D synthesis. So that's why we do supplementation, and it is very important to maintain good vitamin D levels. Apart from that, in the dietary sources, like I said before, you can include fatty fishes, liver, or eggs in the dietary if you are a non-vegetarian, and for vegetarians, sources like fortified cow milk, cheese, butter, or yogurt are the sources for vitamin D. And with vitamin D, sometimes we need to take good source of calcium also, which is usually available in milk, but again calcium can be supplemented on the advice of your doctor. Thank you for listening to this video. Hope this video helps you in understanding the role of vitamin D. If you like this video, please subscribe to our YouTube channel and share this information with other parents also.